The following presentation will demonstrate the immediate need of medical marijuana in New York State by sharing stories and statements of caregivers and of those in need. It will also explain why the Compassionate Care Act is so very important to everyone in New York State who suffers daily from these debilitating, life-threatening ailments.
Well, I'm Gabriel Saya with the Drug Policy Alliance and Compassionate Care New York, here today in Albany with a great group of patients and caregivers and healthcare professionals calling on the State Senate to pass the Compassionate Care Act. The Compassionate Care Act is a comprehensive bill that would create a tightly controlled and regulated system of patient access in New York for medical marijuana. We need this in New York. There's thousands of patients and their families who every day are suffering. People living with cancer, MS, severe epilepsy syndromes, PTSD. People across the state of New York deserve some relief, and this bill could provide that. 20 other states have medical marijuana laws currently. That includes Arizona, New Mexico, Colorado. Every state in the Northeast actually has it, except for New York, Pennsylvania. Even Canada and Israel, as countries, have medical marijuana systems in place. We should have that here in New York. The Compassionate Care Act is a comprehensive bill. It will serve the patients in New York while maintaining strict controls over the production, access, and distribution of marijuana for medical use. Patients will have to get a recommendation from their healthcare provider in order to obtain it and register with the state. The state will be able to monitor who's getting it, monitor the doctors that are recommending it, and everything will be kept under a strict system of control. But we're only waiting right now for the New York State Senate to act. The governor supports medical marijuana. His office has said he'll sign this bill if it's passed through the legislature. The Assembly's already passed the bill. We're just waiting on the Senate to act, and we want them to stop messing around. No more foolishness, no more delays. The lives of New Yorkers are really depending on this.
My son, Thomas Frank Williams, was born June 6, 2005. He was a happy and healthy baby, progressing normally until he received his 4-month DTaP shots. Within 3 days of receiving the inoculations, he began having seizures. He was diagnosed with infantile spasms. They immediately performed an EEG and discovered he had a condition called hypsarrhythmia, a constant misfiring of the brain. Soon, Tommy was having over 100 seizures a day. As he got older, his condition was updated to Lennox-Gastaut syndrome, a very severe form of epilepsy. Many of the experts believe Thomas had an allergic reaction to the pertussis in the DTaP shot. Thomas is now 8 years old. Over the years, he's tried about every anti-seizure drug available, some of them several times. He has also tried experimental medications. He's had a VNS implant, which is a vagus nerve stimulator, a kind of pacemaker for the brain. When he was 5 years old, he began aspirating on liquids and had to have a G-tube installed in his stomach so he could receive all his liquids and medications. Despite all our efforts, nothing has been much help to our son. The doctor's long-term prognosis is not good. We were told that he could have a seizure at any time, which could leave him brain dead or even kill him. My wife and I were ecstatic to learn that a new medication made from the cannabis plant was having unbelievable results in treating children like our son with severe epilepsy. A group of brothers in Colorado named the Stanley Brothers had genetically engineered a type of plant that contained almost no THC, the euphoric part of the marijuana plant. It was extremely high in CBDs, or cannabinoids. Technically, cannabinoids are diverse chemical compounds that activate cannabinoid receptors on cells that repress neurotransmitter release in the brain. In other words, it helps to control seizures. This new strain of plant is called Charlotte's Web because of the success it had on its first patient, Charlotte Fiji, whose condition was critical from suffering constant, debilitating seizures. After the first dose, it began to turn Charlotte's life around and her family's. Charlotte can now walk and talk and can even dance. Ever since Charlotte, child after child has been having amazing results using this new form of medicine. My wife and I, along with many other parents who have children who are suffering daily with little to no relief and whose lifespans are greatly threatened, want the opportunity to try this medicine on our children. My son's neurologist and his entire neurological institute want Thomas to try medical marijuana as soon as possible. The doctors say our son has nothing to lose, and it may be the only thing out there that can save his life or greatly improve the quality of his life. A strict bill known as the Compassionate Care Act for the legalization of medical marijuana in New York State has passed through the Assembly many times. The New York proposal was drafted with careful, strict controls. Under tight regulation, a patient who has been certified by a healthcare provider to use medical marijuana would register with the New York State Department of Health and receive a patient identification card. Specially approved organizations such as hospitals or community health centers would dispense the medical marijuana to registered patients under the Department of Health's supervision. For some unknown reason, the New York State Senate has refused to vote on legalizing the use of medical marijuana to help so many people who suffer terribly every day. The argument from some that this is a gateway drug does not apply in this case. All prescriptions would have to be written by a licensed New York State physician. Those prescriptions can only be written for the terminally ill or those going through extreme pain and suffering, and for uncontrollable seizure conditions. Some people against it have also said they do not want to see a child smoking it. This medication is given as an oil, either orally or in food or in a pill form such as an aspirin. And to date, there has never been a fatality using medical marijuana, and there has been little to no side effects. The governor has stated that he's in favor of medical marijuana for critical AIDS and cancer patients, but has not included our children. I'm asking all the residents of New York State to contact their local senators and representatives, asking them to support the Compassionate Care Act. It could be just a matter of time before someone you know or care about is suffering from a medical condition causing uncontrollable, never-ending pain. We need to take advantage of this God-given plant and use it for those who can find no other form of relief. It makes no sense that a politician with absolutely no medical background is able to decide how our loved ones should be medically treated, especially when doctors with years of education and experience are recommending it. Thank you.
I'm Holly Anderson. I'm the Executive Director of the Breast Cancer Coalition in Rochester, New York, and I'm here today advocating for the Compassionate Care Act. The Compassionate Care Act is a comprehensive piece of legislation that is inclusive of all patients who science has shown would benefit from medicinal cannabis. I'm not only here advocating for the patients that we serve, those living in the aftermath of cancer who are dealing with nausea, vomiting, pain, end of life issues, but I'm also advocating for physicians who have been telling patients for many years in our region that if anti-nausea drugs do not work, to go ahead and use medicinal cannabis or cannabis medicinally. They tell patients that if they can access it safely, to go ahead and use it, but most of our clients, patients, feel conflicted about that. They don't have access to it legally. They've got to get it on the street. We don't know where it comes from, how it's treated, what kind of a product it is. So I'm here today lobbying, advocating for this particular act, which will include all patients. It's been wonderful getting to know all of the families that this would impact, and I'm here proudly standing with all of them to get the best piece of legislation we can.
My name is Beverly Mcclain. I'm a stage 4 breast cancer patient, which means I cannot be cured and probably only have a couple to few years left to live. And I've been helping support the Compassionate Care Act because I honestly believe that medical marijuana has great usefulness for people in my situation and also so many others, MS, epilepsy. There's so much that it can do. And it's insane to have people, our elected officials, going really against the will of the people. I mean, 88% of the people in New York State support it. So it seems to me that our elected officials need to follow suit, and quickly, because there are people like me who don't have much longer on this earth and would really appreciate the benefits of legal, safe marijuana. Right now, I do smoke it, but I have to rely on shady sources in order to get my hands on it. I don't know how safe it is. I don't know if it's been sprayed or you know, there are bad chemicals on it. I'm really looking for it to be given the respect that it deserves as an herb and plant that has enormous medical value for so many people, and I'm not going to shut up until that happens. Thank you.
When Tony was born, he appeared healthy and he was beautiful. Maybe about 3 to 4 months, when Tony was 3 to 4 months old, I noticed he wasn't looking at things the way his younger brother did when he was a baby. And at about 6 months, I started noticing some kind of jerk, and I didn't know what it was. And Tony's eyes were rolling in the back of his head, and he was eventually diagnosed with acid reflux. And at that time is when we started doing all kinds of EEGs, and eventually Tony was diagnosed with a Lennox-Gastaut at the age of 2. And from ages 2 to 3 were just it was just a big blur of seizures nonstop, and those first couple of years of seizures were just, they were hard. Non-stop in the hospital, in and out, just trying to control endless seizures. Since then, it's been a whirlwind of, you know, trying to gain control, and Tony having, you know, a couple of good weeks at a time, and then it's right back at trying to get his seizures under control. They can come at a moment's notice, and everything stops, and we call 911. And Tony has, over the years, been on, I can't even count how many medications. The main ones that he's been on have been phenobarbital, off and on from the beginning, and it's not a very mild kind of a medication. It's very sedating, and he can have good control with that medication for a while, and then it just stops working. The side effects are scary, and Tony's had reactions to different kinds of meds. He's had rashes on his back that we still don't know which one of the meds it came from, but he's been on, I can't even count how many different medications. We've been on them, stopped them, and when the meds that he's on, when they stop working, we have to go back onto the meds that he's been on in the past. And it's a lot of the times it's starting a med, stopping a med, and trying one that we've tried in the past, and just hoping that this time it works. And it does work for a while, but not very long. When there's an option available like medical marijuana, and you see it helping so many other children that are very similar to Tony, it's an option, and I want to try it. I want my son to be able to try it.
Well, I really wish everybody would just jump on board and try to get this passed to where, you know, my family wouldn't have to move out of town. I don't want to see my grandson have to leave, and
he needs it.
Just, yeah, I can't do it. I'm sorry. I'm sorry.
It's all right, Mom. I don't want to have to leave New York State. This is our home. This is where we live. I wouldn't want to break my family apart to leave New York to go somewhere where the medical marijuana is helping other kids there, I want it here. I want my son to have a better quality of life, and I want to do it here at home. Please do whatever you can to help pass this.
Hi, my name is Susan Racinko. I live in Auburn, New York. I suffer from multiple sclerosis. I'm here today in the Capital Region to urge our New York State Senate to pass the Compassionate Care Act. As I stated, I suffer from multiple sclerosis on a daily basis. I have issues that go from a range of bladder and bowel issues to fatigue. I suffer many cognitive ailments from multiple sclerosis. I have used as many as 17 pills a day and been in a prescribed drug-induced haze. That wasn't my life. I need to live my life and be able to get up every day and function. And unfortunately, New York State Senate and our governor has left me no other option but to obtain a medication that I should have legal access to, but unfortunately I have to use illegally, which is marijuana. Marijuana has allowed me to stand here today and tell all of you that it does work for MS. I can function because I use marijuana. I urge you to contact your local government and please ask them to pass the Compassionate Care Act.
Hi, I'm Nancy Rivera. I live in Troy, New York, and I'm here at the Capitol asking that state senators pass our Compassionate Care Act, and I'm asking people in the general public to support it by calling our senators' offices either in their district or at the state capitol in Albany, and also to give a call to the governor of the state, Governor Cuomo. I am a four-time cancer survivor, and I suffered very much 3 years ago when I needed to have painkillers for my cancer treatments, and I could have used medical marijuana if it was available at that time. It wasn't, and I didn't, and now I'm asking that this bill be passed, because if something came up where I needed treatment again, my family would be very appreciative, and I would be appreciative that we had the option to have safe medical marijuana available to us and not something of street value. The Compassionate Care Act is the most comprehensive bill that anyone will find in this state, and we're just asking that people will please help support that bill and get the education if they need it about the bill, and help us to get it passed in this session.
Morgan Jones is a 3-year-old girl who suffers from a severe form of epilepsy called Dravet syndrome. Morgan has seizures almost every day. Her doctors have tried almost every medication and treatment available. She's been prescribed practically every anti-epileptic drug on the market. Many of these drugs are considered narcotics and are highly addictive with endless side effects. None of them are FDA approved for a child her age. Unfortunately, none of these drugs have worked. Morgan's neurologist told her mother, Kate Hintz, to consider removing a portion of Morgan's brain, hoping perhaps it could decrease her seizures, although it would not stop them. Such news has left Kate's family in tears. For the most part, Morgan does not leave her home. All her services are provided by New York State, including numerous therapies via early intervention and private nursing via the Care at Home Medicaid waiver. Morgan experiences numerous side effects and additional disabilities from her condition. Her quality of life is currently at a level of someone living on hospice care. It's not much of a life for a 3-year-old to live. Waiting for the inevitable seizures to occur puts a heavy burden on Kate and her husband and her entire family, and they're no longer able to live the once vibrant lives they were all used to. Children in states like Colorado are seeing drastic reductions in seizure frequency by taking a special oil formulated specifically for epilepsy. Many of them are reporting huge improvements in cognitive skills and, most importantly, quality of life. Kate and her family believe that their daughter Morgan should have the same opportunity here in New York State. Recently, Kate attended a conference at NYU on the topic of CBD and neurological diseases. She heard scientists from all over the world share their discoveries on the benefits and promising results from medical marijuana studies. Currently, 5 of the leading children's hospitals in the United States have or are in the beginning stages of using CBD to specifically treat pediatric epilepsy. Morgan's family is not asking for marijuana to be legalized for recreational use. They're not asking for marijuana to be legalized for general illness. They're asking that patients with chronic, life-threatening conditions be allowed safe, reliable, compassionate access to specific strains of medical marijuana when prescribed by their doctors.
Hi, my name's Donna Romano. I'm from Syracuse, New York. I'm a veteran of the Vietnam-era war, and I have multiple sclerosis and I have a seizure disorder. The reason I'm in Albany today is to advocate for medical cannabis to be able to be used by patients like myself for symptom management, pain relief, and much more. I'm urging my senator, Senator DeFrancisco, and any other senators that I can speak with to pass the Compassionate Care Act. This act would allow New Yorkers who suffer with various diseases to obtain access to medical cannabis through their health provider and form a good relationship there with a drug that can help many different people in many different ways. So I hope that each of you would call your senator or your assemblyman and urge them to support the Compassionate Care Act. It's a comprehensive legislation already drafted and ready for a vote. Just urge them to bring it to the floor and vote in the Senate.
Hi, my name is Christine Emerson. I'm a pediatric nurse practitioner and I reside in Rochester, New York. I have a daughter, Julia, who's 7 years old, who suffers from refractory epilepsy, which is epilepsy that is not treatable by the current medication or other forms of treatment for epilepsy to date. And I'm in support of the Compassionate Care Act because there's a great potential that medical cannabis could greatly improve her quality of life and potentially help alleviate her from her seizures that she suffers from on a daily basis. I think that the Compassionate Care Act is an all-inclusive bill. It would not leave any patients out, patients with MS, glaucoma, any autoimmune disease, neurological disease, and I think that having a limited bill would not be sufficient enough for what we need for our New Yorkers who are severely suffering. I really think that getting this Compassionate Care bill passed would allow people to have a better quality of life and potentially even cure some diseases such as epilepsy. At this point in time, the Compassionate Care Act has passed the Assembly 5 times, which we applaud the Assembly members for continuing to press forward with this bill. We are urging the senators right now to at least bring the bill to the floor for a vote. You have constituents in your area who are suffering on a daily basis, and this would alleviate that. And these are the people you're representing. So you're basically telling them that they're not able to obtain legally a medicine that would potentially help them live a daily life that's much better than what it is now. So we really do need to get this Compassionate Care Act passed this year. We can't wait one more year to have this done. So please urge your senators to really champion this cause and step forward. And it may be uncomfortable, but this is what we need to help people in New York.
Oliver Bud Miller was born healthy, but within 7 weeks began having health issues. Oliver has been diagnosed with an intrauterine stroke which caused a brainstem injury. Oliver also has multiple medical problems such as cerebral palsy, dysautonomia, panhypopituitarism, and Lennox-Gastaut syndrome. Oliver's now 14 years old, and like many others, Oliver's family has tried countless medications with little to no results. Oliver's family needs your support. He needs to be able to have access to medical marijuana in New York State. His doctors approve, and there's an 86% chance Oliver could benefit from it. He and his family shouldn't be forced to lose their home, their family, their friends, and their jobs in order for Oliver to have a better quality life. Please contact your local senator and ask them to support the Compassionate Care Act.
Hi, my name is Katie, and this is my brother Oliver. Oliver suffers from seizures that don't respond to medication. He used to be so alert, but every day he loses more and more skills as a result of the seizures. I don't think it's fair that there's a medication out there that can help save my brother's life, but we can't get it here in New York. My family is willing to do whatever we have to do to help bring this medication here to New York to save Oliver's life. Can you say hi?
Hi.
Hi.
Hi, my name is Jim Lister. I live in the West Village of Manhattan, New York. I'm here in Albany lobbying for the Compassionate Care Act. I'm a person living with full-blown AIDS since 1996. I'm not only lobbying for myself, but for the hundreds of thousands of other people living with AIDS that medical marijuana would be very beneficial for to combat the side effects of all the medications that we need to take to combat the virus and to suppress the virus. We need to be able to include everyone, not just people living with AIDS and all their comorbidities and side effects, but also there are lots of children who have seizures, and there are a lot of other factors and health issues that this would cover. We're asking the Senate to bring it to the floor, Skelos and Klein. The Assembly has done their due diligence and has passed the act. And also that Governor Cuomo would push for the Senate to do so, and that he would sign it forthwith. Thank you very much.
Anna Conte is 8 years old and was diagnosed with Dravet syndrome, a severe form of intractable epilepsy at 10 months of age. She has tried and failed 13 anti-epileptic medications with varying combinations with no seizure control. Her parents now import some of her medications from Europe. When Anna was 18 months old, she had to have a Metaport inserted into her chest so the paramedics would have access to her already scarred veins. 2 months later, she had to have a tracheotomy placed. Anna has been hospitalized over 70 times, with some stays lasting longer than 3 months in duration. Anna continues to have daily seizures of varying types. Her tonic-clonic seizures can last up to 3 hours in duration, which then requires an emergency visit to the hospital. She is prone to aspiration pneumonia due to having left vocal cord paralysis caused by all the emergency tube placements. Anna currently takes 16 rounds of heavy benzodiazepines and barbiturates daily that have a profound effect on her day-to-day living activities, as well as potentially having a harmful effect on her kidneys, liver, and bone marrow. The family may be forced to separate while Anna and her mother move to Colorado, where medical marijuana is legal, while Anna's father, brother, and sister stay back to sell the house and family business. Anna's family is asking for your help. Please contact Governor Cuomo's office as well as your local senator and tell them they need to pass the Compassionate Care Act as soon as possible. Thank you. Please take a moment to contact Governor Cuomo's office as well as your local senator's office and ask them to support the Compassionate Care Act. Thank you.